Funding for the Maddy Report is made possible by grants from the California Emerging Technology Fund, leaders in the quest for digital equity. The James Irvine Foundation, committed to a California where all low-income workers have the power to advance economically. Fresno State Associated Students, Inc., students serving students. BNSF Railway, moving our economy for 160 years. And The Wonderful Company. The Maddy Report is also made possible thanks to contributions from Harris Ranch Inn and Restaurant and E&J Gallo Winery. From the Maddy Institute, the Public Policy Institute for the Valley's 4 public universities, this is the Maddy Report with Executive Director of the Maddy Institute, Mark Keppler.
Welcome. Over the past decade, Medi-Cal expansions and the Affordable Care Act have improved access to health insurance for millions of low-income Californians. And while access to health insurance does not necessarily mean access to health care, it has made health care more affordable, and that one would assume that would have a direct impact on poverty rates. So what is the impact of providing health insurance on poverty in California? Our guest is someone who would know, since she recently authored a report on that very issue. We're welcoming back Shannon McConville, a health policy expert with the non-partisan Public Policy Institute of California. Welcome back to the Maddy Report.
Thank you so much, Mark. It's great to be here.
So listen, can you briefly explain how the healthcare system in California currently is structured and some of the recent changes?
Sure. So, most of us have health insurance, whether it's through an employer or the government or the private insurance market, and that really helps cover the cost of healthcare. But just because we have health insurance, you have health insurance so that you can access medical care when you need it. And so just having health insurance doesn't always necessarily guarantee you can access healthcare, but it does make it much more affordable, and it should also help you to navigate the healthcare system, so to know where to go to get healthcare. And another big thing is that health insurance should really offer financial protection in the event of a major health crisis. And so in recent years, we've really seen an increasing number of people with health insurance, and a lot of that does have to do with the Affordable Care Act. It expanded Medi-Cal to millions of low-income adults who didn't have children or a disability, which was the requirements before the ACA came in. And then it also created insurance marketplaces. So we've really seen this large expansion of people with health coverage in California over the last 10 years or so.
We deal with a lot of public policy issues on the Maddy Report, and I will say probably one of the hardest, if not the hardest to deal with, is healthcare. It is such a labyrinth. It's a Byzantine structure, very hard. And frankly, reading your report gave me the willies a little bit, because it says you indicate in your report that we're likely to see public and subsidized healthcare in California both expanding and potentially shrinking. I'm scratching my head. What does that mean? How can you have both?
No, it's true. So over the last 3 years with the pandemic, the federal requirements to annually check income were relaxed. And so the federal government really wanted to keep people insured. And so the Medi-Cal, which is our Medicaid program, but the Medi-Cal program stopped doing annual eligibility redeterminations. As a result, many more people stayed on the program. And so we have about 3 million more people on Medi-Cal than we did at the start of the pandemic. And it's also the case, though, so that's the expanding part, that those redeterminations are starting up again. They actually started in April of 2023. And so we're going to start seeing people fall back off the rolls, although many of them will have other health insurance, employer coverage. So even though they're not eligible for Medi-Cal any longer, they will be connected to other coverage. Some will likely become uninsured. But the expanding part, though, so that's actually the shrinking part. The expanding part is that we're going to be, California is going to be expanding Medi-Cal to undocumented immigrants, regardless of age. And so we've had children be covered by the program, and now anyone is going to be, if they're income eligible for Medi-Cal, regardless of their immigration status, they will have access to the program.
And they've been squeezing that for a while now, adding folks incrementally.
That's exactly
now
right.
Everyone. So you noted that the cost of healthcare coverage is not necessarily included in the federal poverty measure. So given how big healthcare costs typically are, I guess they would be for a person's typical budget, that seems to be a pretty big omission. It seems to be would play a pretty big role in how poverty is measured in California.
Absolutely. And so, one of the reasons why why health insurance hasn't been included in past census supplemental poverty measures really was because it was hard to tell how much health insurance might cost someone. And so another reason why the Affordable Care Act actually gave us the ability to do research like this is because it made changes to the insurance market. And now people can only be charged more money based on their age, not their health status. And that allowed us to really incorporate health insurance into the poverty measure so that we could understand if we think of health insurance as a basic need, what does poverty look like in terms of the resources that people have?
Now, you also talked about in your report, which I find interesting, is the impact of all of this on a family's health and financial well-being. Could you just briefly talk about that?
Sure. So on average, families, we calculate the California poverty measure. We calculate a threshold, which is supposed to represent how much a family needs over the course of a year to make ends meet in California. And this is really basic level of resources: housing, food, and now health insurance. And so we found that on average in California, a family of 4, 2 children, 2 adults would need about $55,000 a year in order to kind of have their basic needs met. And I think for most of us who live in California, that $55,000 for a family of 4 still feels pretty low. And I will say of that $55,000, $17,000 is related to health insurance coverage for the family.
It's a big chunk of what people pay. When we come back, we're going to talk about the exact bite that health insurance does take out of a typical family's budget. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. We're talking with Shannon McConville. She's a health policy expert with the Non-Partisan Public Policy Institute of California about healthcare coverage and its impact on California's poverty rates. So I'm assuming that it is you mentioned earlier in the earlier segment that it is a significant part of a family's income. These healthcare cost issues. You mentioned I think it was $17,000 out of $55,000. My calculation, isn't that about a third? And that's huge.
That is almost a third, right? And so that is a big cost for a family. And again, this would be a family with 2 adults and 2 children, but about $17,000 in order to have a level, or have comprehensive health insurance for their family. I will say it also varies pretty significantly across the state. So the California poverty measure does account for differences in housing costs and other variations across the state in the cost of living. But housing is really that crucial piece. We're also able to do something because health insurance actually has different costs across the state as well. And so in our study, we found that, say, in the San Joaquin Valley, in Fresno and other areas, that the poverty threshold, or what you need in a year, is about $45,000 a year. And that compares to some counties in the Bay Area where it's closer to $70,000. And again, housing is a big part of that, but health insurance is also more expensive in certain parts of the state, and that contributes as well.
Yeah, and it's amazing. We're one state, but quite different. There was actually a report done a while ago, and they were talking about breaking up the state. And they said that if you divided California into like 5 states, you'd have the richest state adjacent to the poorest state. The richest state would be the San Jose area. The poorest state would be in the nation, in the San Joaquin Valley. So the regional differences are quite extreme in California. So you think housing, is that a major contributor to the regional differences?
It absolutely is. And so housing is a major contribution. And again, as we know, housing is it's more expensive in the coastal parts of the state. So the California poverty measure, and taking that into account, actually does see higher poverty rates than one might expect in coastal areas like the Bay Area, because it does incorporate that higher cost of housing. And again, health insurance also has some impacts, but housing is the big driver of those variations across the state.
Yeah, let me ask you this. So you developed this thing called the California Poverty Measure. What does it reveal about Californians who don't have health insurance? I mean, I would assume that there'd be quite a difference between the poverty rates of those who have health insurance and those who don't.
That's right. About almost 40 or 4 in 10 uninsured Californians are in poverty when we consider health insurance as a basic needs. And that makes sense, because in our measure, you need health insurance and it costs this much. But if you're uninsured, you don't have any of that resource. And so that does really increase poverty rates among the uninsured. Uninsured poverty rates are twice as high as low-income families that are covered by Medi-Cal, because Medi-Cal does provide that resource of health insurance to families. So even despite their low incomes, which qualify them for Medi-Cal, our estimate says that Medi-Cal, with the health inclusive poverty, that poverty rates are about 18% for those on Medi-Cal. And then those who have employer-based insurance have the lowest poverty rates at about 4%.
Yeah, I was noticing that in your reporting, 18% is still high, but 4% is pretty low. And those are folks you're saying who have health insurance through their employer.
That's right. And so, people with employer-based health insurance likely have higher incomes, and just,
Right.
the selection or the sorting of people who have health insurance through employer, those tend to be better jobs, full-time jobs. And so that really does have an impact on, your overall resources for your family.
Yeah, and providing health insurance and better pay for some of these with their employer-based health insurance, because they want to keep these employees. So they're going to pay them a sufficient amount and provide the benefits to retain those employees. So those are a little bit maybe higher skilled in jobs and frankly, better employers in their particular industry. So what role does demographics play in all this? Are there variations in poverty rates across various demographics?
There are. And these really kind of also align with who we know are more likely to be uninsured. And so non-citizens, so that includes both people who are legally residing as well as undocumented immigrants, and also families without high levels of education. So some of what you had just mentioned. So those groups, so people with less than a high school education and non-citizens have the highest health inclusive poverty rates, in large part because they have the highest uninsured rates, right? And when we're taking health insurance into account, it really does have quite a big impact. We also found higher poverty rates for younger people in California, who tend to also have higher rates of being uninsured.
Yeah, you would argue, though, they would argue that, of course, they don't get sick, so maybe they don't need health insurance as much. There's this invincibility, invincibility. At least they believe it, though it may not be true. And the first medical disaster they have is going to totally turn things upside down. When we come back, we're going to talk about the billions that have been spent on providing health insurance to low-income individuals. Has it really made an impact on reducing poverty in California? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. As I mentioned at the top of the program, over the past decade, Medi-Cal expansions and the Affordable Care Act have improved access for health insurance to millions of low-income Californians. What impact has that expansion had on the poverty rates in California? We're talking with Shannon McConville. She's a health policy expert with the Non-Partisan Public Policy Institute of California. By the way, I would encourage folks to check out the PPIC website. If you want to get information on public policy issues, they do a really outstanding job, very fact-based analysis, and I would encourage you to take a look at it. Well, as a general rule, Shannon, how much does Medi-Cal coverage impact poverty?
Right. So when we did kind of take the step to include health insurance as a basic need in our study, we found that poverty rates in the absence of Medi-Cal. So if Medi-Cal was gone, and this does assume that people are not getting covered by another source, we find that poverty rates for Californians under 65 would increase over 60%, from about 11.5% of people in poverty to almost 20% of people in poverty without Medi-Cal coverage. That translates to an increase of about 2.4 million more people in poverty if they weren't getting health insurance through Medi-Cal. Now, again, it's important to note that we are assuming that all of those people would become uninsured, to kind of help ground the estimate. And that's probably, that's not necessarily realistic. Some of those people would likely be connected to coverage in another place, but it would have a large impact.
Well, what about children? What impact does it have on children?
Absolutely. And so children are covered by Medi-Cal. I think throughout the state, almost 40% of all the state's children are covered by Medi-Cal. Medi-Cal pays for about half of all births in California. And so for younger children, especially, it's a huge role. And so in our estimates, the child poverty rate would almost double or more than double if we took Medi-Cal, if Medi-Cal wasn't available. And again, that's assuming all of these children would become uninsured.
At 40%, that's, think about it, that's a staggering number.
Medi-Cal covers almost a third of the state's population. In regular times, not even in pandemic times when we've seen the rolls really increase. It is the cornerstone of our health insurance.
People don't understand what a big part of healthcare is in the state budget. I mean, right up there with education. A lot of people think, oh, prisons. No, that's way down the list. It's education, healthcare, the two biggest drivers in the budget. Let me ask you this. The biggest group that doesn't qualify for Medi-Cal, at least historically, have been the undocumented. There have been efforts, as we talked about, to expand Medi-Cal to all eligible undocumented immigrants. Some say that, the undocumented shouldn't receive any government support. There are others that say we'll need to deal with the healthcare needs of these folks. They're here. What are we going to do? Let them die on the streets? And so you're going to have to address the problem in some way. So I'm just wondering, is the thought that it's better to be It's you can provide better and cheaper healthcare, to be proactive when you're dealing with the healthcare needs of this population rather than being reactive. In other words, give them some medication for their blood pressure instead of waiting until they have a heart attack and end up in the ER. It's much less expensive to give them a pill for hypertension. Is that the idea? And maybe that then will lower, not only give better healthcare, but lower healthcare costs?
That is the idea. We want people to have routine access to the medical care that they need, right? And you made the point earlier that maybe some young people don't really have health issues, but when you do have health needs and so chronic conditions, and we do know from other studies that people who are undocumented do have some high rates of, they do have some conditions that would be better managed. And you mentioned the emergency room. And so the hospital emergency rooms are required to treat anyone, regardless of whether they have insurance coverage, regardless of their immigration status. And so if someone isn't taking care of, say, their diabetes or their high blood pressure, then they could end up in the emergency room. And that has the potential to be more expensive. And so just as a general rule, I think having health insurance and treating, in a primary care setting, really trying to keep people, keep their health conditions managed and keep them healthy is what we want to do.
I think I can sum it up for you. An ounce of prevention is worth a pound of cure.
Beautiful. That's lovely. That's where it comes from.
It's appropriate since talking about healthcare, but it just seems if we have a problem, what's the most cost-effective way to deal with it? You can't just ignore it. And so, being proactive seems to make some sense.
It's also true that, and we can keep people healthy and keep people working and everything else. There are all these other benefits as well, I think.
We only have about 30 seconds left, but I did want to ask you about the ACA. What impact has that had on poverty rates? And maybe you can give us some quick numbers.
Sure. Well, so the other piece, we've talked a lot about Medi-Cal, but Covered California is the state's insurance marketplace, and that really has allowed a lot more people to get coverage as well. They get subsidies through the federal government. So Covered California, in addition to Medi-Cal, covers about 1.6 million people in the state, and that's stayed pretty steady. And again, about 90% of people who have coverage through Covered California are receiving some type of federal subsidy, usually about $500 a month. Yeah. So it is pretty significant.
That's a great summary. Well, when we come back, we're going to talk about health insurance. Just because you have health insurance doesn't automatically mean you have health care. Is providing health insurance a way to really improve health care or simply putting a Band-Aid on a problem? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. Healthcare is generally considered a basic need, but just providing health insurance doesn't mean you're going to forget healthcare, because you have to have a doctor that's willing to take you on as a patient. Sometimes that's an issue with government-based health insurance programs. We're talking with Shannon McConville. She's a health policy expert with the Non-Partisan Public Policy Institute of California. So are there any concerns about the quality of care provided to Medi-Cal enrollees?
Yeah. And, I don't know that I would necessarily put quality, but clearly there are longstanding concerns around the access to care provided by the Medi-Cal program. In terms of costs to people who are enrolled in Medi-Cal, they're really minimal. Most people there's no premiums, or very few people pay premiums, and there really aren't copays. So in that sense, access is good for Medi-Cal enrollees, although fewer physicians will treat Medi-Cal because it does pay less than other insurance providers. And there have been studies that show that Medi-Cal enrollees do have a harder time finding a doctor who will accept their insurance compared to, say, someone who has private insurance or an employer, or someone who has, say, insurance through Covered California.
And that's when you look at how they trying to bend the cost curve. What they're bending the cost curve is by reducing reimbursements to doctors. That maybe they need to look at other ways to cut costs. But let me ask you this: what do you think? How do you think access to care can be improved for Medi-Cal enrollees?
So you did, you've hit the two things. So we really do need more, I would say, primary care providers, and we need them to be better distributed across the state. Honestly, access is an issue, not just because of reimbursement rates, but because of where physicians and where healthcare providers are located. And we've known this for a very long time, and we're still trying to get more doctors and more primary care into, say, places like the Valley, right? We have a lot more doctors in the Bay Area than we do in other parts of the state. But you also touched on a big thing. It is, providers, there aren't as many providers who accept Medi-Cal because they pay so much less. And so then it's a conversation of how we have more resources. Most of the resources for the Medi-Cal program actually come from the federal government. And so it's both federal and state that we really need to think about that. And the last thing I'll say there is that our healthcare safety net, community clinics, really do serve this vital role. So making sure they have what they need can also really help access, I think, for Medi-Cal patients.
Yeah, the number of medical students. Well, first of all, we don't have a medical school in the Valley, though we're beginning to get one at UC Merced. But that's been an issue forever. The number of medical care providers. We actually have a family friend whose daughter is entering into the UC Merced program that has automatic admission to medical school after undergraduate. She's a part of a cohort, which is going to, a lot of people who go to school in the Valley end up staying in the Valley, so that may address that problem. Are there any concerns you have over the cost or access to healthcare that it might change after the expansion of Medi-Cal in 2024?
We've expanded the program so much in the last, 10 years. It's really exploded in terms of under the Affordable Care Act. And so, access it has been an issue in terms of costs. Again, the federal government is really providing a bulk of the funds, although state funding for Medi-Cal has increased in recent years. I think you made the point of trying to balance out people having preventive and primary care with supporting, say, emergency departments or our safety net when they do need to treat people. So I don't know that I am that concerned about costs. They'll likely to be managed, and we can, it's a complicated question, maybe.
Yes. All of these are. I'm asking you to do that
at another time. Yeah.
Yes, in a short period of time. But one last question. Only got about 30 seconds left. But just, they expanded all of this with COVID, the COVID pandemic. Do you think they're going to make those expansions permanent?
I will say that, there's always, so the concern right now is that all these redeterminations for eligibility will happen and people will lose coverage. They might still be eligible because we don't know how to get them back into coverage. And so we're focused, the Department of Healthcare Services that runs the Medi-Cal program is really focused on doing outreach and trying to keep people in the program. There's always people who, what we call churn, they may stay eligible, but they don't meet those redeterminations, or they don't stay in the program even though they're eligible. And there's a lot more focus and effort right now to make sure people are. And so I'm hopeful that folks who are eligible are going to be more likely to keep their coverage and stay in Medi-Cal. But it is something that we need to be tracking. And luckily, I think there's a lot of folks at the state that are looking at that and trying.
And you will be as well. I want to thank our guest, Shannon McConville with the Nonpartisan Public Policy Institute, for joining us. This is Mark Keppler with the Maddy Institute. Thank you for joining us.
The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.org.